There are so many options when it comes to Medicare, and one of which is Medicare Advantage. But why would someone choose a Medicare Advantage plan? As always, if you have questions about Medicare or health insurance in general, you can reach us in the comments or at the number on the screen. Now, please, before we get too far into today's video, make sure to subscribe to stay up to date because we do release these videos on a weekly basis. And of course, we just ask that you click that like button, give us a thumbs up so we can get this information out there. Thank you so much. All right, let's dive right into it. Medicare Advantage plans are also known as Part C plans, and sometimes people refer to them as managed care plans. They are actually an entire replacement for Original Medicare. That means that you cannot have a Medicare Advantage plan in conjunction with Original Medicare. Now, sometimes people get Medicare Advantage plans confused with Medigap plans, also known as Medicare Supplement plans, but they are definitely not the same. Medicare Advantage plans are offered by private carriers, and the costs and the benefits can vary widely. They can even offer benefits that aren't actually offered by Original Medicare or Medicare Supplement plans. Additionally, these types of plans will impose an out-of-pocket maximum, which is not offered by Original Medicare. Now, on the flip side, you will have to work within a network, like insurance you've had in the past, and unfortunately, these networks can be restricting for some people. So let's talk about one of the first reasons that some people choose a Medicare Advantage plan, which is, of course, the costs, specifically the premiums. Now, Original Medicare really does offer truly comprehensive coverage. However, there are still deductibles and copays in coinsurance, and these can be a bit of a financial stress for some people. Additionally, Original Medicare does not offer an out-of-pocket maximum, and that's there to protect you should you have major healthcare bills in a given year. Now, Medicare Advantage will impose an out-of-pocket maximum to provide that protection. And very often, these plans will have lower deductibles and copays and coinsurance when compared with Original Medicare alone. Now, of course, Medigap plans would also help with those deductibles and copays and coinsurance, but that's the topic for another video. Now, even though there are these additional benefits offered, and very often the copays and coinsurance and deductibles are lower, the premiums for Medicare Advantage plans are usually pretty low as well. Now, some plans claim to be free. That is absolutely misleading. Medicare Advantage plans are not free. At the very least, you still need to continue to pay for Part B. However, for many plans, there's no additional premium on top of that. Now, this may sound great, and there can be a major cost savings. However, the networks really can be rather restrictive to the point where Medicare Advantage plans can be prohibitive for many people. Many people have reported that they find difficulty in finding a doctor or specialist or even a hospital within a reasonable distance who accepts their plan. Another reason someone might choose a Medicare Advantage plan is for those extra benefits that I mentioned. So very often, Medicare Advantage plans offer additional benefits that aren't offered by Original Medicare and therefore a Medicare Supplement plan. So this can be appealing for a couple of reasons. First of which, it can be much less expensive to have all of those additional benefits bundled with your health insurance. And of course, it can also just make things easier because it's really just one-stop shopping. You may not have to look around for dental or vision or hearing, etc. So let's take a look at some of those benefits that are offered. Here on Medicare.gov, we're able to compare the different Medicare Advantage plans offered. Remember, these are plans that are available in a specific area, so the plans that are offered in your area may be different. Now, on the right-hand side of the screen, you will see the plan benefits offered. These are some of the most common benefits offered. That's not to say that these are all of the benefits that could be offered by your plan. For example, there are some plans that will offer you a certain amount of money monthly on a card at a given grocery store or something like that. So some of the most common benefits available are vision, dental, and hearing, which are very important. And then also you may find that transportation is offered. There could be fitness benefits, worldwide emergency if you're somebody who likes to travel, telehealth if you're someone who enjoys telehealth services for some of your more basic needs so you don't have to actually go into the doctor's office waiting room. Also, it offers over-the-counter drugs, so there are many plans that will offer you discounts or even a certain amount of money to spend on over-the-counter drugs in specific drugstores or through a mail-in pharmacy. This plan also offers in-home support. And then you'll see that these are X'd out. Again, these are some of the more common benefits. So it doesn't offer home safety devices and modifications, and it also doesn't offer emergency response devices. And you will see if you scroll down that prescription drugs are covered. Now, if you know what prescription drugs you take, you can click here where it says add your prescription drugs to get a general idea of what your drugs might cost. Now remember, this is a general idea, so it's not 100% accurate perhaps, but at least it gives you a jumping off point. If you were to scroll down, you would see some other plans. Again, this one's going to offer, looks like basically the same benefits, prescription drugs. This one would offer you emergency response devices. So remember, not all Medicare Advantage plans do offer prescription drugs, but it's likely that if you're going to go the Medicare Advantage route, that you're going to want to make sure that your Medicare Advantage plan does offer prescription drugs. So you can see here that this plan doesn't include prescription drugs, and it doesn't include anything else that's X'd out as well. Now, as I mentioned earlier, as far as the monthly premium is concerned, you'll see that it says here $0 monthly premium, and then in smaller print, it says that this doesn't include the $164.90 standard Part B premium. So you would still need to pay for that. And if we scroll up, you'll see a lot of these plans will have that $0 monthly premium. And then here are your out-of-pocket maximums as well. That is designed to protect you from major medical bills. So we're scrolling up, lower out-of-pocket maximums. This out-of-pocket maximum is only $1,000. Now, comparing Medicare Advantage plans is a little bit more complicated perhaps than comparing, let's say, Medicare supplement plans. So please do work with a broker if you go the Medicare Advantage route. Medicare Advantage plans also offer special needs plans. For example, they offer C-SNPs and D-SNPs. Now, C-SNPs are chronic condition special needs plans. Basically, this type of Medicare Advantage plan is specifically tailored to meet the needs of a specific chronic condition. And the list of qualifying chronic conditions is really quite extensive. We'll take a look at that in just a moment. But basically, you might notice that for your particular condition, any specialist or extra support that is needed might be offered with a lower copay. Now, this information is also available on Medicare.gov. So if you scroll down, this is the list of chronic conditions that will make you eligible for a C-SNP. So the list has 15 different categories with different subcategories. So chronic alcohol and other drug dependence, autoimmune disorders, all of these that are listed. Also cancer, however, that excludes precancerous situations or conditions. Cardiovascular disorders, all of these included. Chronic heart failure, dementia, diabetes, end-stage liver disease, end-stage renal disease that requires dialysis, severe hematologic disorders, including all of these. Also HIV/AIDS, chronic lung disorders, including all of these, chronic and disabling mental health conditions, including all of these, neurologic disorders, including all of these, and stroke. So the list really is quite extensive. So if you find yourself diagnosed with any of these diseases, then you might at least consider a C-SNP. That's not to say that a C-SNP will be your best bet. You may still be better served with a Medicare supplement plan, and there is a reason that Medicare supplement plans are far more popular than Medicare Advantage plans, but you should at least know that this is an option for you. And then there are D-SNPs. D-SNPs are dual eligibility special needs plans, and these are for people who are eligible not only for Medicare, but also Medicaid. And they will offer you the full benefits of Medicare and Medicaid, very often with several additional benefits thrown in as well. Now, if you'd like to learn more about D-SNPs and C-SNPs, we've got videos dedicated entirely to those topics, which I will put in the description below. Now, in the interest of full transparency, yes, Medigap plans are still far more popular than Medicare Advantage plans, and that is because of those restrictive networks, issues with pre-authorization, which can be a major problem, and of course the inconvenience or hassle of needing referrals with a Medicare Advantage plan, specifically if we're talking about an HMO. But Medicare Advantage plans can be great if they work for your specific needs, your budget, and also your location. Yes, your location plays a major role in whether or not Medicare Advantage is right for you. For example, in Florida, Medicare Advantage plans are much more accessible, and there are many more doctors and hospitals who are willing to accept Medicare Advantage plans. But do remember, if you move out of state, if you move to a different location, then you'll enter into a special enrollment period, and you can apply or enroll in a different plan at that point. And of course, if you do try a Medicare Advantage plan and it turns out that it's not right for you, there are many ways that you can actually leave your Medicare Advantage plan, either to switch to a different one or to get rid of Medicare Advantage entirely and make the switch back to original Medicare, perhaps with a Medigap plan. And we do have a video all about how to leave your Medicare Advantage plan, which I will also put in the description below. But in the meantime, if you have any questions whatsoever, please feel free to give us a call at the number on the screen, or you can reach us in the comments below. Remember, we are licensed brokers and we are licensed nationwide, so we're happy to help wherever you are. And of course, there is absolutely no charge for our services. Just one thing that we ask before you go, please do make sure to subscribe to stay up to date, and please, please, please click that like button so we can get this information out there. As always, thank you so much for watching and have a wonderful day. Bye-bye.